I'm Dr. Tina Dudney. I am the Program Director for the Pulmonary Critical Care Fellowship Program at the University of Tennessee Medical Center in Knoxville. Our program provides the fellow the opportunity to have excellent clinical training within a broad spectrum of pulmonary and critical care diseases in a very collegial atmosphere. My faculty is engaged, they have diverse interests and abilities, and are all committed to fellowship education. In addition to the longitudinal continuity clinic, the fellow's outpatient experience also involves pulmonary hypertension clinics, interstitial lung disease clinics, clinics in both interventional pulmonary and thoracic oncology, and a strong adult cystic fibrosis program. We combine these outpatient clinical experiences with an inpatient pulmonary consult service where the fellow learns a broad array of procedural skills as well as performs consultation for a variety of services within the hospital. We additionally have a multidisciplinary critical care service to round out our pulmonary critical care training. Our critical care service provides the fellow not only the opportunity to learn the procedural skills necessary to be a competent intensivist, but also to manage critically ill patients with a variety of pathologies. The fellow also is able to obtain leadership experience in conducting a multidisciplinary critical care team with the support of an attending physician. The fellow is involved both in the pulmonary service on the floor and in the critical care unit as an educator of junior learners, and also leads the interaction with our advanced practice providers in the ICU. Our pulmonary consult service allows the fellow the opportunity to engage in a variety of standard and advanced bronchoscopic techniques, as well as pleural procedures. We also have a point of care ultrasound program where we use therapeutic and diagnostic modalities in the management of both pulmonary and critical care patients. We have the ability to have our fellows obtain internal certification in point of care ultrasound. They also have the ability to do right heart catheterization with our pulmonary hypertension faculty, and we encourage them to consider pursuing echocardiography boards at the end of their fellowship. We are a level 1 trauma center, so our fellows have the opportunity to rotate with the trauma critical care physicians as well as our neurocritical care physicians. During the neuro ICU rotation, the fellow is expected to obtain certification in the ENLS program. We are the critical care support for the entire general medical population in the hospital, and also are the admitting physicians in the cardiovascular ICU for our cardiology colleagues. We have an ECMO program, and our cardiac physicians are developing an advanced heart failure program as well. We have new fellowships that have just started in maternal fetal medicine, but we also are planning a hematology oncology fellowship program. Research is an important part of fellowship training, and our fellows are provided with dedicated research time. There is an array of experiences both for basic research or clinical research on our campus, and our fellows have the opportunity to collaborate with or affiliate with the University of Tennessee College of Veterinary Medicine, Oak Ridge National Laboratories, or the University of Tennessee Knoxville campus. Our fellows are encouraged to present nationally and are supported in the conversion of those presentations into publications. The fellows are exposed to a research boot camp at the beginning of their fellowship so that they can learn the basics of statistics and research design. Fellows also have the opportunity to participate in research projects in interdepartmental groups as well as industry-sponsored clinical trials. Our fellows have a 100% board pass rate, and the focus on passing the boards begins at the beginning of the fellowship with a weekly board review conference. Our fellows have gone on to do subspecialty training in sleep medicine, and we've also had fellows who have obtained their boards in interventional pulmonary. Our fellows have gone to other institutions where they have developed interventional pulmonary programs and have also taken on a variety of leadership roles at those institutions, including Chief Medical Officer. Our fellows have pursued both academic and private practice careers. My areas of interest include critical illness in pregnancy and pulmonary disease in pregnancy, as well as medical ethics and graduate medical education. I'm a Tennessee native, and I did my internal medicine residency training at the University of Tennessee, Knoxville including a fourth-year chief resident position. I then went to the University of Utah in Salt Lake City to pursue my pulmonary critical care training. Knoxville is a great place to live, and that's one of the reasons I wanted to come back to UT. It has all the amenities of a large city, but with the friendly, small-town community feel. There are a variety of outdoor resources available for our fellows, including hiking in the Great Smoky Mountain National Park. We have extensive water sports that are available with our variety of streams, rivers, and lakes in the area. And of course, there's always college athletics, and once you come to Tennessee, you'll be a volunteer for life. We have an active arts community, and Knoxville is just all around a good place to live, to raise a family. The schools are good, the cost of living is low, and Tennessee is a no state income tax state. We pride ourselves on having our fellows have a balanced life. They work hard, they learn a lot, but they play hard and relax too. The University of Tennessee Medical Center Knoxville is a great place to work. We have wonderful facilities, and we're also very fortunate to have the support of the Graduate School of Medicine, the Department of Medicine, and University Health Systems, our hospital system. We are fortunate in that in an era when many hospitals have struggled with all the changes in healthcare, our hospital leadership has been able to maintain financial stability. And because of this, they have been able to continue to expand clinical, educational, and research services for our facility and for our trainees. So all in all, University of Tennessee Medical Center Knoxville is a great place to train if you want to become a competent, compassionate physician with the ability to pursue a career in pulmonary critical care medicine, whether it be academics, private practice, research, or administration.